The most common eye conditions that we see in our community, in the Black community, are things like cataracts, glaucoma, diabetic retinopathy, which is basically a fancy word for eye problems from diabetes, like bleeding, swelling, scarring in the back of the eyes. Macular degeneration also, myopia, nearsightedness, which is a condition that a lot of times can have vision impairment issues in our children that can lead to eye health problems as an adult. I'll start with cataracts. Cataracts are a clouding of the camera lens right behind the pupil of the eye. And early on, there are not much symptoms, but it's a clouding. And so there's a whole gradient from just a little cloudiness to the eyes to almost no light getting to the back of the eyes or very, very blurry, hazy vision. People can live with cataracts for a long time, as long as it's not hampering their lifestyle. In other words, when it's starting to hamper your driving, or it's starting to hamper the things you normally like to see where you're squinting, that's when it's time to really think about cataract surgery. And we monitor that, and I let patients know when we see a deficit in their vision. So if you have your best eyeglasses on and you're starting to have really issues with glare, blurry, cloudy, poor visual comfort, that's when we have that discussion about having cataract surgery. And that's where we work really, really closely with our ophthalmology colleagues, our surgical specialists. Glaucoma is a condition that damages the nerve fibers in the back of the eye, where light comes into the eye and we have nerve fibers that convert that light to electrical signals that goes to our brain. And it's really our brains that we see with, our brains that convert that light signal to a picture that we move through the world every day with and interpret and perceive things, and look at colors and look at how bright things are and how sharp you can see it. Now, the dangerous thing about glaucoma, it's called the sneak thief of sight. Why is it the sneak thief of sight? Well, people lose their side or peripheral vision first. And this is a slow process that can happen over years in the most common instances. So by the time someone notices that they have issues seeing to the side, it's too late. They cannot get any of that vision back. Why? Because the nerve fibers have been permanently damaged. I have a number of patients that have advanced glaucoma that can see 20/20 or maybe a little bit worse straight ahead, but they have no side vision. And the problem is you can't get it back. So we want to put our patients in a position where we can detect these changes early. And again, for over 30 years, when we catch it early, I can't think of any patient that we've caught early with glaucoma and managed them and seen them like we're supposed to that have lost functional vision throughout their lives. So early detection is key. Another condition that people commonly hear about is macular degeneration. Macular degeneration is where the tissues in the back of the eyes, that in part where you see vision straight ahead, where your clearest vision, well, that tissue becomes aged and diseased. So think about wrinkling of your skin over time. Sometimes your skin might not be as supple over time, but there's pigment changes in the back of the eyes that can affect adversely the vision. And so you get this little spot in the center of your vision, or you may get some distortion in the central part of your vision. And macular degeneration, if it's advanced a little bit, can cause some blurry vision. In early detection, what we found is that there are certain nutritional supplements, dietary changes that can help slow down that progression in macular degeneration. And guess what? We used to be taught that people of color really didn't get macular degeneration. And that is totally, totally false. I have a lot of Black people that have macular degenerations. One other condition, which is more in our youth, is myopia. Myopia is just basically another word for nearsightedness, where your vision far away is blurred. And we have technologies now that can help our children at a very, very young age to help slow down that progression in nearsightedness, to where when they're adults and teenagers, they don't have as thick eyeglass prescription. People with very substantial myopia or nearsightedness are at higher risk for things like retinal detachment, macular degeneration, and glaucoma when they're adults. So now that we have various technologies to help our children early on, we can reduce the impact of vision impairment from nearsightedness for the rest of their lives. So that's another reason children should be seen earlier. Family history impacts your eye health because it is a significant risk factor, especially in glaucoma, especially in diabetes, especially in macular degeneration, especially if the parents of a child have thick prescriptions or nearsightedness. So it's a risk factor. It's not a guarantee that you're going to get these conditions. But again, you want to reduce and manage your risk factors.